This segment is sponsored in part by One Brooklyn Health.
February is Heart Health Month, and we want to make sure you know the risk factors and warning signs of heart disease.
Our friends from One Brooklyn Health are here to help you take care of your heart and know what to watch out for. Welcome, Dr. Chadow and Dr. Adedayo. Thank you for being here.
Thank you so much for having us.
Of course. So I was shocked to know this.
Yeah.
Heart disease is the #1 killer of New Yorkers. So Dr. Chadow, who is at the highest risk for heart disease?
So we know that men over the age of 45, women who are postmenopausal, are at the highest risk of heart disease. Traditional risk factors include those with high blood pressure, diabetes, high cholesterol, especially an elevation in their low-density lipoprotein called LDL. We know that patients who smoke, even secondhand smoke, is deleterious to the heart. We know that patients who are overweight, physically inactive, have a higher risk of heart disease. And we also know that while unhealthy life choices, so for example, poor dietary choices, while a glass of red wine might be beneficial, so-called French paradox, we also know that excessive alcohol abuse is actually detrimental to the heart as well.
Wow. Okay.
Yeah.
Dr. Adedayo, what are some of the warning signs then that people should be looking out for when it comes to this?
Well, so chest pain is a huge symptom with heart disease or heart attack, and it comes in different flavors, so to say. Things like a patient will complain about feeling of squeezing in the chest, aching sensation, or pressure as if something heavy is sitting on the chest. And these are some of the traditional common signs or the way the patient presents the symptoms. Also, there are some atypical symptoms, things like indigestion, a feeling of sudden intense nausea or vomiting, and lightheadedness. These are some of the things that are warning signs of heart disease or heart attack.
Yeah. And it's not just heart attack, because heart disease can also increases the risk of stroke. Is that correct?
That's absolutely correct. Because remember, these things walk through the arteries, and depending on where the region of the artery that is affected will have the manifestation. If it's in the heart, we call it heart attack. If it's in the brain, we call it the stroke, or sometimes I tell my patient, brain attack. So the signs of for stroke is things like numbness, sudden change in behavior, or a poor speech or inability to talk or to answer questions. These are some of the things that can present as a presentation for stroke.
Scary.
Yeah.
What is One Brooklyn Health doing to help the community and then treat heart disease?
So there's an old adage, the best offense is a good defense.
Ah, yeah.
So what we have done is we have several practice locations in the community. So when the patients come in, we first establish what we call a comprehensive risk profile, assess the risk of each patient. And then we could begin to tackle some of these risk factors that we spoke about earlier. Treat their high blood pressure, treat their diabetes, get their high cholesterol under control, provide them with a heart-healthy diet, an exercise program. And then what we could do is, besides the initial screening, for example, doing a sonogram of the heart or a stress test when necessary, we also have the ability to look at advanced imaging. We have the ability to look at CAT scan, CT, cardiac CTs. We have the ability to perform cardiac MRIs.
Wow.
Once those patients actually now come into our hospital with an emergency, we have several award-winning programs to treat them. So we have heart failure programs. We have a STEMI program so that if a patient comes in with a heart attack, 24/7, those patients could be brought to our cath lab and we could unclog those arteries very quickly. We have an award-winning stroke program, so those patients who come in with a stroke, we can limit the damage done by these devastating strokes. We also have programs around the ability to clear clots in the lungs, called mechanical thrombectomy.
Wow.
That's a huge killer. 50% will never even make it to the hospital. And of course, we have the ability to treat abnormal heart rhythms. We have the ability to perform ablation procedures to interrupt those abnormal heart rhythms, as well as implant pacemakers and defibrillators. So really a global approach to enable us to treat these patients, both in the outpatient arena as well as in the inpatient space.
The community is in good hands with you
That's
guys.
right.
You've
you.
got it all covered, all bases. Doctors, thank you so much for being here and for this valuable information.
Yeah.
Thank you so much
Thank
for
you.
having
Thank
us.
you
Of
so much
course,
for
don't
having
forget
us.
to scan the QR code to learn more about staying heart